All right. So as you know, this is an accountable care organization, also known as an ACO. The ACO, there are several benefits to an ACO. One is by choosing Cubic or the Aetna Whole Health Program, it does give you and your family access to highly coordinated, member-focused, and doctor-driven care. With this particular ACO, it is a commercial product and it is a plan that is through Aetna. So Aetna is the insurance carrier. Cubic is the program and the entity that actually manages the particular Aetna Whole Health Program itself. So Cubic does stand for Quality Partners in Care, and it is a partnership between Health Texas, which is the main primary care physician group, and Baptist Health System, which is the Baptist hospitals. So it's Baptist hospitals that are part of the ACO network. And then again, Health Texas is the main primary care physician group. There are other primary care physician groups that are in the network, but we are the partner within the program. The ACO operates in 4 counties. We do operate in Kendall, Bexar, Guadalupe, and Comal counties. There are other ACOs that are out there, so that are in those other counties, like in Austin area and San Marcos. So those are part of Baylor Scott White. Ours is the Baptist Health Texas network. Part of what we're going to go through today is within our agenda is quality of care, the primary healthcare partners. We touched on that a little bit, the hospital network, our provider network, what does the ACO cover, and our educational materials. So the quality of care, the biggest challenge and the biggest piece here is, one, it's member driven, it is member focused. We want to, in the past, the traditional part has been members going to an office visit, or if they have an emergency outside of the traditional time period, going to an ER. So there's multiple different facets today that a member can actually utilize versus just going to an ER when their doctor's not open. So the first part is we do have Saturday clinics. The Saturday clinics are 2 of our Health Texas locations, our San Pedro and our Paramvital, or San Pedro and the Wurzbach clinics. The members still need to call. So it's not a walk-in clinic. Our members would need to call the 210-572-8890 number to get an appointment, and just let the members know that you have Aetna Whole Health when they're taking that call. But Saturday clinics are available for same-day sick appointments. So we do want to make sure that our members are getting in. You do have a network navigator, which is me, to help navigate primary care physicians if you're looking for a specialist, or if you're trying to figure out where you can go that's in the network. We do also have same-day sick appointments for you wake up in the morning, you have strep throat, you have sinus infection, those specific issues that you would typically go to your primary care physician for. You have same-day sick appointments available to you. You do not have to be established with the Health Texas provider for those same-day sick appointments, but we want to make sure that you guys know that they are available. You also have access to case management. So if we have a member that has gone to the ER or has had an inpatient visit, our case managers are going to reach out to you, and it doesn't matter whether you're with a Health Texas provider or not. Those case managers with Health Texas manage the entire ACO population. So those case managers will outreach, because we want to make sure you're getting the care that you need upon discharge, or you're getting the care that you need for those follow-ups. Sometimes you might need DME services, or maybe you need to have that follow-up with a primary care physician, or maybe you need home health, or you need some other type of service after discharge. We want to make sure you're getting that care and getting that help that you need. And we do have extended hours. Some of that is our Saturday clinics. We do have one clinic today that is open on Tuesdays until 8 p.m. That's our Stone Oak clinic. And then our other clinics, some of our other clinics are open from 7 in the morning, 7 or 7:30 in the morning, but they all close at 5 now. But we do have those 2 that are open on Fridays from 8 to 5. And the other options that are available too are the urgent care clinics that are part of our ACO network as well. As I mentioned earlier, Health Texas is the main primary care physician group that's part of the ACO network. So we do have board certified providers. Health Texas now has 18 locations. The new location is our Shirts location. But we do have 18 locations now. We have over 65 providers. And then again, we have the same day and Saturday appointments that are available. This is a quick map of the Health Texas locations so that you have an idea of where they're at. If you did have a Health Texas provider, you do have access to their HALO app. So you just go through, look at the HALO televisit tutorial. You can download the app via Google Play or the App Store. The cool part with the HALO app is you can still do televisits via the HALO app. So again, if you're out of town, you have access to that availability. You can go in there and have regular appointments. So if you're coming in and if you're sick, you can still do that HALO visit versus having to do a physical office visit. You can review statements. You can even pay those statements. Again, you can do the virtual office visits and you can send your questions to your primary care physician as well. If you need a primary care physician, you can go to the Health Texas website, which is at healthtexas.org. And then the virtual visit is where you go for that, for those virtual visits with the HALO. The Baptist Health System, there's several different programs and offerings that they have for the within the hospital system. They do have the cardiovascular. They also have stroke, muscular oncology. The biggest one that they also have the imaging, but the biggest one is, I don't think many people know that the North Central Hospital actually has a pediatric wing. So that opened up, I want to say 5 or 6 years ago, but there is a pediatric wing at that North Central Hospital. So these are the different hospitals that are part of the ACO network, as I was mentioning, but again, it's Baptist Health System. So it is St. Luke's Baptist Medical Center, North Central Baptist Hospital, along with their pediatric ER, Northeast Baptist Hospital, Mission Trail Baptist, and Resolute. So Resolute Health Hospital is in New Braunfels. I know in the past, many people weren't aware that Resolute Health Hospital was part of the ACO network or was part of Baptist. I think since then, Resolute or Baptist has added the Baptist logo underneath the Resolute logo so that it's identifiable that it is a Baptist facility. Some of the other Baptist facilities that are in the network are those Baptist emergency hospitals. So they're now called Baptist neighborhood hospitals. Those are emergency rooms. Those are in the network. However, I would still want to steer to the regular hospitals because if it is a true emergency, sometimes those Baptist neighborhood hospitals will end up having to ambulance you over to one of the other hospitals. Just so that give you an idea of the network itself, you can see the urgent cares. We have 45 different urgent cares that are part of our ACO network. So there are urgent cares that you're able to see and go to. For example, Texas Med Clinic is one of those, and Texas Med Clinic does have 3 urgent cares that are open 24 hours. So we want to give you an idea of the network itself so that you understand that it's not necessarily a very small network, which is why we say not so narrow of a network, because you do have choices. But this map here is just showing the urgent cares. It's showing the hospitals as well as the ER locations. It showed the physical therapists that are part of the ACO network, as well as the imaging centers, because it is Baptist M&S imaging that you would want to go to. This is a quick map of some of the providers, like our primary care physician groups, as well as our OBGYNs. So as you can see, we don't have just Health Texas providers as part of our ACO network. There are other provider groups that are part of our ACO network as well, such as MedFirst, WellMed, Gonzaga, South Elmo Medical Group, which is now part of WellMed. But there are over 400 primary care physician groups that are part of our ACO network. We have the 14 hospital locations, which does include those ER facilities that we talked about. There's over 2,500 specialists. And again, there's the 45 urgent cares. The imaging centers. So for mammograms, CT scans, x-rays, those sort of things, you want to go to Baptist M&S Imaging. Strict is not part of our ACO network, so we do want to make sure that people are aware of where to go. It is the Baptist M&S Imaging locations that are part of our ACO network. The labs that are in our ACO network, this was one of the questions that was asked. So the labs that are part of our ACO networks are LabCorp, Quest, CPL, and if you are seeing a Health Texas provider, the Health Texas labs are part of the ACO network as well. And if you have a provider that you're seeing, and if it's not a Health Texas provider, you do want to make sure that they're sending those labs to one of those 3 other locations. Some of us women have to go get screenings, get blood drawn when we get, especially when we're pregnant, we have to go get blood drawn with our OBGYN. You just want to make sure when you're seeing them that they're sending those labs, not to their internal lab, but to one of those 3 locations, CPL, LabCorp, Quest. Same day sick appointments, as I talked about briefly, that having access to the same day sick appointments at over 30 locations. You would call that 210-572-8890. That does get you to a Health Texas or a Health Texas contact center. So, but you do have that availability. Just make sure you let them know I have Aetna Whole Health. That phone number is specific to our Aetna Whole Health population, but we do want to make sure that you identify I have Aetna Whole Health, and you're calling for a same day sick appointment. You do also have access to your 24-hour nurse line. Not sure how many of you guys are actually aware of that, but you do have access to that availability. So that phone number is what is on here, the 800-556-1555. So you can call the Aetna nurse line and talk to them as well. And they can help direct your care. So if they, based on what you're telling them and your symptoms, they can direct that you might need to go to an urgent care, or you might need to go somewhere further, or call your primary care physician. Again, you have access to televisits, so you have access to telehealth. Most of the employer groups that are part of the ACO have access to teledoc. So that teledoc number is here, which is the 855-835-2362. We do recommend that you get set up prior to actually needing it, because it does take about 20 to 30 minutes to go through the entire process. So trying to set that up when you're not feeling well will tend to not necessarily have a really good warm and fuzzy about it, because when you're sick, you really want that care and you want that service right now. But when you get set up beforehand, before you actually need it, the service and time of care is more expedient. So we just recommend that you get it set up beforehand. Again, you also have access to the urgent cares. The different urgent cares and when to go to an urgent care is on here. So, when you have ear infections, sore throats, UTIs, sometimes even gastro issues, you can go to an an urgent care versus an ER. So there's several different reasons and times that you can go to an urgent care versus going to an ER. Many times you can also, if you're seeing a Health Texas provider, for example, you actually have access to your providers 24/7. There is an on-call provider. So many times if you're seeing a Health Texas provider, you can call your clinic even after hours, and a provider will answer. And because it's an on-call provider, so they will answer, they will take they'll ask your symptoms, they will ask different things and ask questions. And many times they can direct your care that way as well. So just know that those options are available to you. So one of the other questions that we do get a lot as well, if I select the ACO or if I'm part of this, what happens when I'm out of town? I have kids in college, I'm out of town, I'm on vacation, those sort of things. You still have access to teledoc. You have access to those virtual visits with your primary care physician when you're sick. You still have access to the Aetna 24/7 nurse line. Many times, especially if you have kids that are in college, when they come into town, they can come into town, get their annual screenings, go get their physicals and that sort of thing when they're here, summer break, spring breaks, those sort of things. But they still have access to they still have access to emergency rooms wherever they're at, if it's a true emergency. So if they broke a collarbone or something, because maybe they were in an accident, they still have, if it's a true medical emergency, they can go to the nearest ER and it's going to be covered by Aetna as if it were a network. So the members still have that access, whether they're in town or out of town. Now, if they go to that same ER because they had strep throat, that's not a covered benefit because it's not a true medical emergency. So Aetna's not going to cover that. It's going to be considered out of network. But again, if it's a true medical life and death emergency, you go to the nearest ER, and that's regardless whether you're out of town or in town. So we do want to make sure that you're aware and you know that access is available. Now that is the same for now we're going into prescriptions. You're out of town, you called teledoc, they sent a prescription to the Kroger down the street. Prescriptions are covered in any city, any state, in another state, in another location. It is not limited to the service area. That is true even if you're out of country. You're going to be able to get that prescription filled. You're going to be able to go to the nearest ER, even out of country, if it's a true medical emergency. You're not going to drive back to San Antonio when it's a true medical emergency. So we talked a little bit about the urgent cares. So you have urgent cares or emergency room. The different urgent cares that are part of the network are MedPost, Concentra, Quality Urgent Care, FastMed. And if you were to go and Google MedPost today, it is going to pop up under FastMed. It's going to say MedPost is now part of care. Oh God, it's care something. Sorry, but it's part of FastMed. So MedPost was bought out last year by FastMed. You have the Main Street Urgent Care. Main Street Urgent Care is actually in Bernie. So that is it. It was added last year. Prompt2 Urgent Care, it does have the Christus logo. Prompt2 Urgent Care has been part of the ACO network since the very beginning. It was bought out, I want to say a couple years ago by Christus. But because it is an urgent care, we kept it in the network. So, but know that Christus hospitals are not part of the ACO network. Okay, so we do want to make sure that you're aware of that. Texas Med Clinic, as I talked about earlier, is part of our ACO network. And there are 3 24-hour locations that are part of our ACO network as well that they have. Those are one is off of Loop 1604 and Culebra. The other is off the one on I-10 in Wurzbach. And then the third one is off of I-35 and Loop 1604. And then again, you do have the Saturday clinics that Health Texas has available as well. Now, of course, if it is life-threatening, you're going to call 911. If you're not sure, you can call your primary care physician and they can help direct your care. Or again, you can call, if you're not sure where to go, you can also call that Aetna nurse line and they would be able to help direct your care as well. If you do need an in-network primary care provider, you can go to our Cubic website, which is qpicsa.com. And there is a section there that says doctors, and you can select that, and it has primary care physician groups, has pediatricians, it has OBGYNs. It also has the urgent care map, as well as the hospitals. So it gives you the different choices that you have available, as well as far as what's in the network. There's a map there. You can type in your address and it'll actually tell you which clinic is closest to you. Or I can do that for you as well. Or you can call me, as I mentioned earlier, at the 210-920-9301. So as I mentioned, we do have the extended hours and Saturday hours with Health Texas. There are some other clinics that have extended hours as well, such as South Alamo Medical Group, Gonzaga have extended hours. You may have seen some of the flyers that we have sent out previously, but we have Saturday screenings. So for example, we have Saturday mammograms because we are a working population, let's face it. And sometimes it's very hard for us to take time off of work to go get some of our screenings and get some of those things that we need to have done in order to keep our health, keep us healthy. So we do have Saturday mammograms, and you can go to our QBIC website and actually schedule. We have dates out there through August for Saturday mammograms. So you can go in there, you can select, it's right there, right next to the carousel, and it's in pink. So you can just click that button and it'll actually show you the different appointments that are available. And they're typically in 15-minute increments, and it has the different locations that are available based on the date, based on the different dates that you're looking at. So those are with Baptist M&S Imaging. We have colonoscopies that we're doing that we have on Saturdays as well, that we've partnered with gastroenterology consultants of San Antonio for those Saturday screenings. So we do for the mammograms. Let me go back to that. If you are 40 and above, you do not need orders. What we will tell you though, is to, when you go to the Baptist M&S Imaging location that you picked, let them know, because they're going to ask you for the orders. Just let them know I'm self-referring. I don't have orders. I'm self-referring, and I need the self-referral form. That's all you would need to do. If you're 40 and above. Now, if you're under 40, you do need orders because it has to be a doctor requesting it. The colonoscopies, the colonoscopies in the past were 50 and above. They have dropped this year to 45. So we do want to make sure that people are aware of that if you are 45 to 50, that colonoscopy age range has changed for when people are being recommended to get a colonoscopy, because they've seen an increase of people having colon cancer at a younger age. So they've dropped and lowered that age range. So it is now 45 and above. But we are doing Saturday screenings for those colonoscopies, not us personally, but gastroenterology consultants of San Antonio, and we're helping with that scheduling. So if you need a colonoscopy, you can reach out to us, and we can help get that coordinated for you. We are doing Saturday well woman exams especially with our Health Texas patients, with our Health Texas clinics on those Saturdays at those two different locations, because we know that sometimes that can be a challenge too. And there aren't any OBGYN groups that are open on Saturdays, or have extended hours. So we know that can be a challenge. But for our Health Texas patients if you're seeing a Health Texas provider, that is an availability, that is an offering that we are doing for our patients as well. I did talk briefly about our case management program. For our Aetna Whole Health members that have that may have chronic conditions, maybe you have diabetes, maybe you have heart, high blood pressure, high cholesterol, maybe you have multiple chronic conditions. Our case management team is working closely with you and engaging with you so that we can improve your health. We also have one-on-one assistance as needed. So maybe a member is going to the ER regularly. We want to help those members and engage and help you get the right care at the right time. That's ultimately our goal, is for you to get the right care, right services at the right time. Before you have an inpatient procedure, maybe you have a scheduled procedure that's coming up in next month or in a couple weeks. We want to make sure that you're going to the right facilities, because we want to make sure that where you're going is in the network. So as you're scheduling that with your provider, you can also reach out to the case management team you can email them at cupicm for case management at healthtexas.org, or you can call them at the 210-268-1698, and they can help steer and make sure that you're going to the right place. And they find out, based on your conversation, they find out that you're not, they can help direct that care, and they can help engage and work with your primary care physician, which helps with that coordination of care between your providers and the specialists, help with that coordination of care and steer them to the right facilities, because that's ultimately part of what we want to make sure that is happening as well. And again, even if you're needing that case management service and you're not seeing a Health Texas provider, maybe you're seeing another provider group such as MedFirst or WellMed or one of those others provider groups that's part of our ACO network. Health Texas manages the program itself. So Health Texas does the case management for Aetna for this particular program. So, and for our members that are part of our program. So even if you're not seeing a Health Texas provider, our case management team is involved, and you can reach out to them and they can still help coordinate that care. We also want to talk mail order pharmacy. That's another big piece. You do have access to mail order pharmacy with CVS Aetna mail service. So you have the 90-day supplies for the maintenance drugs that are delivered right to you, which for many people that's an added bonus, because you don't have to figure out when. You can drive to the pharmacy to pick up your prescriptions, and it just alleviates some of that added stress. You can reorder them online. The standard shipping is free. Again, you can reorder them online, by phone, or by mail, which again helps alleviate some of that added stress, as many of us have families and little children. And some may have children that are in high school, and you're having to go back and forth and drive 3 or 4 different places every night. And that can be challenging in itself. And having to add one more thing to the plate, it just helps alleviate some of that added stress. How to get started. You would just want to make sure you ask your doctor for 2 prescriptions. One is for a 30-day supply, because it can take up to 30 days for that mail order prescription to go through. So you want to make sure you ask for a 30-day supply and a 90-day prescription, so that is being submitted to the mail order pharmacy. The form can be found on Aetna's website. The link is down below. And it does medication order form. You can also, when you pull that form, you can send it to your primary care physician, have them complete it, and then have that form faxed to that 187 number that I have here, which is the 877-270-3317. I have confirmed that it's still the same. Or you can mail the form in as well. So those are how you can get started with with the mail order pharmacy. If you don't have a primary care physician and you're wanting to build your care team, there's several ways that you can do it. You can you've elected the ACO plan, you now are part of the program. You then go into the Aetna.com.find website. You can continue as a guest or register. If you register, if you don't have your ID card yet, you can register with your social, you can register with there's a couple different ways that they have available to register for logging in into your program, or you can continue as a guest. The other way is that you can call me and your network navigator, and I can help you. And again, that phone number is the 210-920-9301. If you can also email me at the cupic@healthtexas.org. Because sometimes it's easier and quicker that way, because you may not necessarily be able to talk, but we can go back and forth in email as you have time. To register to go onto the system and building your care team using the Aetna Doc Find website. As I mentioned, you can register as a member, and you can go to register now, or you can log in if you've already registered, or you can continue as a guest. If you continue as a guest, you type in the location address that you're looking for, how many miles. Maybe you're looking for within 5 mile radius or a 10-mile radius. And then you would select search. One of there should be 3 different options that would pop up right away, which say Aetna Whole Health plans. You can select one of those 3 plans. All of them have the same network because they're all the Baptist Health System, Health Texas Medical Group. They all have the same network. Your ID cards will be gold, and they do have the Aetna Whole Health, Baptist Health System, and Health Texas Medical Group at the top of the card. So sometimes you may have a provider group that will ask, what color is your card? Does your card say anything in the middle? It's helping them identify the particular plans in the particular program. As I mentioned earlier, we have some wellness topics, and like, for example, this recording is part of our wellness topics. We have educational recordings that are out on our Cubic website today from past education recordings and topics that we've done, such as diabetes, back pain, asthma, mental health topics. Those are all out on the website. They're also now being added to a YouTube channel because we've added so many different recordings over the last 3 to 5 years. The bandwidth has gotten so much that we've had to create a YouTube channel now. So just so that you are aware that is available and that is out there. We have out on the Cubic website, we have a lot of other pieces that are there too, such as we have cookbooks that are out there. If you go to the member section, there's healthy recipes. There's 4 different cookbooks that are out there. One's a holiday cookbook for diabetics. So there's just so many different resources that are out on that website for you guys as part of our ACO. Part of our member experience, one is we want you to have a positive experience with our ACO. So part of that is knowing what you have access to and knowing who your resources are. So again, myself, Heather Williams, your dedicated network navigator, you do have access to same-day sick appointments. We do also have your case management services, which you can reach out to the 210-268-1698. There is a welcome video that's actually also out on our Cubic website from Aetna. But if you wanted to go directly to Aetna's website and go to the myaetnawholehealth.com, there is a welcome video that gives you more information regarding the ACO program itself. There, we send out a welcome postcard to all of our members. It does say Cubic on there, but it does say powered by Aetna. There is a welcome packet that is out on our Cubic website for the member services and members resources. There's a welcome packet that has a lot of information in there as well. We have membership tools and we have our membership guide. So please go out there and take a look. And if you have anybody that you know that's part of the ACO that wasn't part of this and they're asking questions, you can direct them to me, or you can also direct them to our website as well. Again, you have access to the mail order pharmacy. We do send monthly wellness articles, and we have our health talks that we do as well, such as kind of what we're doing today. It is a provider directed model. The goal is to coordinate the care and have for the patient experience. You do have telemedicine. So for those non-emergent needs, when you're out of town, even when you're in town, you have access to telemedicine. One of the questions that was asked earlier was referrals. Are referrals required or needed? Referrals are not required, but I will say they are recommended. Part of the reason that they're recommended is part of the goal with the ACO is to have that coordination of care. Between you and your primary care physician, you guys are the main focal points within the ACO. To have that coordination of care saves you dollars, saves you time, and allows the provider to coordinate. I usually like to use the analogy of the Independence Day. So I'm hoping many of you guys have seen Independence Day, either one or two, the one with Will Smith. And you have that mothership that's communicating with all the ships that are surrounding Earth. And the mothership is that primary care physician, and they're disseminating information between each other. If you don't have that referral, your primary care physician doesn't know what's going on. They don't know that you've referred yourself to a dermatologist, or you've referred yourself to another specialist. So they can't work with you to coordinate that benefit and coordinate that care. And they can't then get that information and have that information feeding back and forth between them as a primary care physician and your specialist. But it also goes the same way as what if that same information that went to this specialist over here needs to go to this specialist over on the other side. If your primary care physician doesn't know, they can't get that information to the other party. And then you end up with duplication of testing. And those are things that we want to avoid. And those are things that it's why it becomes important that your primary care physician is involved in that care. And many times they will refer you. And sometimes your primary care physician can actually help take care of that need. And you may need to go to a specialist, but sometimes maybe you just got out of the hospital and you do need a specialist. They're going to coordinate and they're going to refer, and they're going to make sure you're getting that coordination of care and they're getting where you need to go. But it all comes back to that coordination of care. So while no, you don't need a referral, it is still recommended because of that reason. So that is actually the end of my presentation, but are there any questions? If you have questions, you can take yourself off of mute, or you can post it in the chat.
Heather, can you go back to one of the maps?
Yes. Do you want this one, the primary care physicians, or do you want the other one?
This is helpful. Gosh, there's a facility in Somerset.
Say again?
Looks like there's a facility in Somerset, Texas.
Yes, there is. Yes. It is RCM Rocha. That is a primary care physician group that is in Somerset. And I will tell you that they have also been bought out by WellMed, but they are part of our ACO network.
What do we look for in the naming of some of the urgent care centers?
So, good question. It would be the urgent care. So we want to steer away from, if it says emergency, that's not an urgent care. So for example, Texas Med Clinic, Concentra, Med Post, and Quality Impact Urgent Care. Those are urgent cares that are in our ACO network, in the Texas Med Clinics. And Fast Med. Those are urgent cares that are part of our ACO network, but you want to look for, it says urgent care and not ER. And it doesn't say emergency, because if it says emergency, that's really an emergency room. So you want to look at where it says urgent care, and then one of those urgent cares that are in the ACO network.
Thank you.
Are there any other questions? I will say, if you do go to our QPIC website, if you are looking for a primary care physician, you can go there. And like I mentioned, there are maps there, whereas this one it's static. The other map, you can, like I said before, you can put in your address and it'll actually show you the locations that are closest to you. And we have that for the urgent cares there as well. Okay, let me see. Yes, the presentation will be available. What I will do after the recording is available, I will email it to everyone that pre-registered for today's event. And so it will be available. What I will also do at a future date with our marketing team is get it loaded onto our website as well. So it will be available out on the website too. Are there any other questions? Okay. Well, I thank you guys for taking the time and attending with me today. I greatly appreciate it. And you guys have a great weekend.